Yes, this is Ishiguro. Today, diabetes treatment, it's not medicine after all that we're looking for improvement. I want to tell you that you need to change your diet, otherwise you won't change. I would like to introduce an example of a change in diet that has been demonstrated in the United States. In the state of Pennsylvania in the United States, there is a local healthcare provider community called Geisinger, which was troubled by the high cost of medical care. And the medical costs for diabetics were also high. The area was rather poor, with many type 2 diabetes patients and a diet that was not well controlled in the area there. The trial was called the Fresh Food Pharmacy, which was a grocery store that provided free nutritious food, not only to patients, but also to their family members. And here's the result 4 years later. There's a value called hemoglobin A1C that is an indicator for diabetics. The hemoglobin A1C value you see has dropped considerably. Then there is the emergency room. The utilization rate of the hospital's emergency room has dropped. And it was confirmed that the amount of medication used by diabetics had been drastically reduced. The average decrease in hemoglobin A1C was 2.4%, which is higher than that of any other medication. People with diabetes, for example, have poor blood glucose control, and their blood glucose level may fall too low or rise too high, or they may have urinary tract infections, which is a very common cause for emergency room visits. In addition, many people have reduced or stopped taking their medication, resulting in weight loss, reduced LDL cholesterol, and reduced triglycerides, which naturally leads to a reduction in the amount of medication taken. And in fact, type 2 diabetes, medical expenses, cost of expenditures. So you were able to cut 80%. Not only did this change the health status of the patient, but it also changed the way the family members thought about their own health. Of course, we prepare the rest of the foodstuffs ourselves, but they started to think about what kind of foodstuffs they should take. In fact, in medical care, it is very common practice to continue administering drugs after they have been administered. In fact, the sales of a hospital or a clinic depend on how much drug is administered and how many times the patients come to the clinic. In that case, people are given treatments that cost a lot of money, or rather, treatments that are expensive. Of course, drugs with high treatment costs are new drugs, so pharmaceutical companies want to sell a lot of them. By selling a lot of drugs and getting people to use a lot of them, a relationship of mutual support between doctors. And that companies is inevitably created, just like a businessman's way of thinking, right? This results in over-medication, etc., and the national medical expenses are getting higher and higher. Doctors are not afraid to try new expensive drugs or injections with unknown effects, which is too afraid for me. They never thought about whether such drugs were really needed or whether there was anything else that could be done. The education is based on the evidence of drug treatment, and from medical school, students are brainwashed into believing that drug treatment is a good thing. So many medical students come to medical school for doing something that is beneficial to patients. However, people are brainwashed into thinking that the treatment of disease is done with drugs, surgery, and procedures. The education for addressing the actual root of the disease and tools to tackle it is not being given. For example, there is a drug for diabetes called metformin, which is very inexpensive. But there is a lot of research that shows that this drug can be used not only for diabetes, but also for the treatment of cancer, for example. When it comes to cancer treatment, expensive new drugs such as molecular targeted drugs, newly developed drugs, have been in the spotlight. Well, not only cancer, but also other chronic diseases in general, and despite the fact that the results show that metformin is effective, people don't pay attention to it because no matter how much they sell metformin, the pharmaceutical companies do not profit from it. So the doctors themselves don't try to understand the root cause of the disease. By the way, it's true that we've been focusing on treatment without understanding diabetes, such as medication, and if that's the case, one of the things that can improve diabetes is a good night's sleep. Then making time not to eat, intermittent fasting, exercising, sunbathing, and coping with solitude and stress will prevent and improve disease. We have been taught that the best treatment for cancer, for example, is early detection. But the best treatment for cancer, for example, is not to detect it early, but to prevent it from becoming cancerous. That's the state of the healthcare industry as a whole. And the early stage cancers, the ones that haven't progressed to a certain stage, well, what can I say? There is a surprising lack of research on what happens to tumors that are not dangerous at the time. If left unchecked, just find them and take them out. Prostate cancer can be detected with the PSA test, but it is not always easy to detect. Prostate cancer is found in the PSA test. There's data that shows that the risk of getting chemotherapy or surgery or radiation or something like that is 47 times more likely to be worse than getting something that will increase your life expectancy. Therefore, what we originally came to medical school for was to obtain knowledge that would enable us to treat patients, prevent their deterioration, and teach them how to prevent illness in the first place. So, as you can see from the diabetes case study, the fact that diabetes treatment can be greatly facilitated and the condition of diabetes can be improved simply by controlling one's diet is not surprising. So, it is important to pay attention to what you are eating and how you are living your life on a daily basis. If you are not exercising, you should exercise, and if you are not getting enough sleep, it is important to manage your day so that you can sleep. You should think about which life is best for you. Please manage our own lives. If you found today's talk useful, please click the high rating button and subscribe to our channel.